Backed by popular demand, Doctors Management brings you the OSHA Dream Training video. While we take OSHA employee training very seriously, we find that practice employees retain more information after watching reenactments of real-life scenarios. Keep your employees thinking about safety while on the job with this engaging training video.
OSHA stands for the Occupational Safety and Health Administration. OSHA requires all employers, even those with only one employee, to provide a safe and healthy workplace for employees. OSHA exists only for the protection of employees in the workplace. It does not cover patients, students, volunteers, visitors, or the general public. The federal or state OSHA poster must be posted where all employees have access to read it, and the OSHA manual must also be accessible. Our story begins with an inspector feeling sorry for herself because nobody likes to see her coming. She thinks that she doesn't make a difference in the world at all.
Washing the hands are very important. It can also help with the universal precautions or anything that you have to handle with the instruments and stuff. When you take your gloves off, you want to be able to wash your hands. You want to wash them for 15 to 20 seconds with soap and water, and you want to be sure that you get all surfaces of the hand. You want to be sure to wash them really good. If you cannot wash your hands before and after you do a procedure and you're able to use a sanitizer, you want to make sure that you use your sanitizer for at least 30 seconds on the hand, and that would give it enough time for the sanitizer to actually work properly.
I hope you enjoyed part 1 of your training. This begins part 2.
HIV has symptoms such as swollen lymph nodes, weight loss, night sweats, opportunistic infections, and skin lesions.
Wow, Elizabeth, what would you do if there were a spill of potentially infectious body fluids?
Let's take a look, Philip. Craig, our reporter, is now on the scene of a recent blood spill.
Thanks, guys. A recent blood spill has occurred here. There are a few items that you would not want to be here. Food, beverages, and cosmetics should not be used or stored in an area where potentially infectious materials may be encountered. The employee who would need to clean up this spill should wear the proper personal protective equipment for exam gloves, gown, and goggles or glasses, and dispose of it properly in a biohazard bag. Anyone who uses latex items should be aware of symptoms associated with latex allergy, irritation, dermatitis, asthma, or even anaphylaxis. Anyone who experiences those symptoms when exposed to latex should report the situation to the employer and future exposures. The employer is required to provide alternatives such as vinyl or nitrile. Now back to you guys in the studio.
Great coverage, Craig. Our next story is about safety devices.